Welcome to Health Professionals Outside the Box podcast. In this series, I'll be talking to health professionals who've leveraged their professional skills to pursue alternative income sources, alternative careers, and entrepreneurship. We will gain insight into their motivations, experiences, and challenges, and learn how we too can carve our own path to finding purpose, fulfillment, and financial freedom. I'm your host, Fee. Thank you for listening. Welcome back to this episode of the podcast. So joining you today is Mitchel Chatukuta. He's a physiotherapist by background and is currently working as an epidemiologist, an occasional editor and board member at Disability and Society Journal. Mitchel, welcome.
Thank you for having me.
Tell us a bit about yourself and your professional background.
Okay, yeah. So, as you indicated, my background is in physio, but I branched on to do other things. So currently, so I did a PhD in epidemiology, and that's why I'm sort of in that field. With the journal, I would say it's related to epidemiology as well.
How long have you been qualified as a physiotherapist?
Okay, so I qualified in 2004, and I worked for 2 years in Zimbabwe, and then I moved to Namibia for 2 years. Then I worked there for 2 years as well as a physio. And then I had, I really wanted to study like global health and development. So I went on to UCL to do an MSc in global health and development. After working for 4 years as a physio. So after the masters, to be honest, I had realized that sort of clinical physio is not really my kind of thing. Like, I enjoyed it. I did it for 4 years, and I felt like when I was working as a physio, like I was kind of limited because it's like kind of working one-to-one with someone with like a specific problem, musculoskeletal, or it might be neurologic or whatever. But I felt like I was coming across many patients who had like injuries or illnesses that were preventable. So that's what sort of influenced me to then I thought, because there was a point I was actually thinking of doing a master's in sports medicine, but then I thought, like I'm so interested in public health, like sort of because it's kind of like a field where it's about prevention. So, and I think it has so much relevance for the population of, for the populations, not just at an individual level. So that's what sort of, I think that was the main driver for me to sort of pursue the MSc in global health.
And then you ventured into epidemiology.
So my PhD was in public health and epidemiology.
Oh, right.
So
okay.
it encompasses both, but I guess epidemiology is the science of public health.
Tell us about the work that you do currently.
So it's mostly like it's research related. So I've produced some articles. Some of them have been published in like academic journals. So it's doing literature reviews, a lot of using computer software to analyze large data sets. So for my PhD, I was looking at how road traffic injuries affect people in the long term. The specific focus was Namibia because it's one of the countries with the highest rates of road-related injuries and deaths globally. So and it was like analyzing national data sets to over like a specific number of years to identify what has happened within that time period. Are the death rates getting higher? Are they getting lower? Are the injury rates? So a lot of analysis. I mean, I loved maths when I was like doing my A levels, and so it felt like it just fit. It was like a natural fit. Yeah, because it's a lot of statistical analysis. So you need to have a really good grasp of statistics or biostatistics in order to to be an epidemiologist or yeah.
All right, interesting. What was the outcome of the study that you did, the research that you did in regarding
the research that
in Namibia?
Mm-hmm. Yeah. Oh, okay. Actually, one of the two of the papers that that have been published this year, so far this year, they're actually from that study. So, if your viewers would like to have a look at what I mean, I will sort of just briefly describe, but if there are people who are interested in like having a look at the actual article itself or paper, journal paper itself, it is available. So I can give you the links, but in summary, so road traffic injuries are a major problem in most countries in sub-Saharan Africa. Namibia is one of the worst ones. So the study that the study that I did showed that a lot of people in Namibia are affected. However, because Namibia has a specific it's a motor from the fuel levy. So every time you buy fuel, there's a levy that goes to like a fund which has been created for all people that are affected in traffic injuries. So you have that fund will provide all the costs for hospitalization, for rehabilitation, and if someone has like severe injuries, for example, if they're paralyzed, they will use a wheelchair, so they will do adaptations to the person's house, so that they can move around, they can have as much independence as possible, because that's the goal of rehabilitation after, as I'm sure you're well aware, after injury or after illness, to try to restore that person to the best, to the optimum level of function. So so this system in Namibia is very unique, but I think it's very our recommendation was that other countries, especially other countries in sub-Saharan Africa, or countries, low and middle income countries that don't have like an NHS type system, the system in Namibia could be replicated, because in many countries, you have scenarios whereby people are involved in car accidents, and they have considerable injuries, but they don't receive any care, any medical care, because they have no money. The hospitals want money up front. An example is Zimbabwe, which is where I'm originally from. You have people that are actually dying because the hospitals are saying we want money up front. And it's not just, immediately in the aftermath of the injury, it's also in the long term, because people with injuries, sometimes even those soft injuries, not severe injuries, soft tissue injuries, minor injuries, those can also affect people. Actually, this was another finding in our study, that even minor injuries affect people in the long term because there's chronic pain. There's they need to make adjustments. They don't have the same quality of life that they had before, because, for example, if someone loves playing football, but they have like a fracture and that develops to arthritis, especially in the scenarios in sub-Saharan Africa and other low and middle income countries whereby the care is not as it's not as accessible. So those people end up not accessing care because they can't afford it, or it could be another finding was that a problem, although Namibia has this system, there were still some people who were not able to access medical emergency care, or because they live in remote areas, in rural areas. There's a lack of knowledge about the fund, about how it works, and also sometimes they might be told you have to, if you're going to have physiotherapy or rehabilitation, you have to go to a specific site because that's the closest one to them. But actually, it may be 100 miles away. So they end up not going because the distance is too far for them to travel. With the injuries that they have, they would need sort of special transport. But even getting just transport is for anyone, it's challenging.
Interesting findings. It reminds me of time when I was still training to become a physio, and I did a placement in South Africa, and I was working in a rehab ward. Right. Injuries I'd seen, sort of the road traffic injuries. These were injuries that people sustained many years back, but were still experiencing ongoing, chronic pain. And it was such a shame due to lack of resources. Yeah. They couldn't get access to the treatment at the time. So
and it's good that you mentioned, what you saw in South Africa, because actually those people that, when people don't get that care, when it's within a certain time period, they are more likely to then develop permanent disability or impairment because it's too late. Sometimes with rehabilitation, it has to be within sort of 6 weeks for the person to reach the maximum potential, whereas maybe 2 years later there's so much muscle atrophy, there's physiologic sort of changes which then mean that injury, which was not initially severe, it might have been mild or moderate, has become a permanent disability or impairment. So it's a human issue that should not be just ignored.
Definitely.
And I think that's why I think all the governments in other countries in sub-Saharan Africa should be looking at that Namibian model, because it's essentially making services that were not available before much more available. And considering how many millions of people are injured in road traffic crashes, the majority of whom are actually in Africa, in sub-Saharan Africa. So I think it's really it's a really good system that they've developed, and I would love to see other countries sort of replicating that, or making efforts to make sure that their populations are looked after.
Are you still working as a physio?
I still work as a physio, but it's I work as a disability analyst. So I work for a company that employs physios, doctors, and nurses. So essentially, I am an analyst, but I am working through that
And what
Mm.
does your typical day look like then in terms of, so is it so you're working part-time as a disability analyst and then part-time as an
Hmm.
epidemiologist as well? Is that right?
Yes.
You know, what aspects of your role as an epidemiologist do you find fulfilling?
Well, like I explained to you,
Mm.
when I was working as a physio or when I was working clinically, I felt really limited in terms of the amount of good that I could do or the amount of people that I could help. So working as an epidemiologist, like I just gave you an example of that article that I wrote, based on the research that we had. So, just seeing that your article being in a journal, you know, I've actually been accepted to present the article findings at an international conference,
Oh, really?
which I'm very honored about. But
Yeah.
that sort of impact, sort of seeing your work having an impact in terms of changing or improving the lives of patients is
Mm.
that that's very gratifying.
It's rewarding. I guess it just
It's
highlights
very
that you
rewarding.
you don't have to be working with patients or individuals directly in order to improve care. You can still work indirect and still make an impact
Absolutely.
in people's lives,
Absolutely.
don't you?
Absolutely. And I feel like in public health, you make a much bigger impact because public health is, you're looking at the health of the whole population. So
Mm.
that way, yeah, it does feel like your work is reaching out to like much more people.
A wider population.
Mhm. Wider
Yeah.
population.
So you write for the Disability and Society Journal. Is that,
Okay. No, so I review.
oh, you review?
So yeah, when people submit articles, there's something called peer review,
Yep.
if you've heard about it.
Yes.
Okay, so
For those that don't know what peer review, do
okay,
you mind just giving a brief explanation?
right, sure. So now for most international academic journals, the standard is that when someone submits work for or their paper for consideration for publication, first of all, it's sort of a main person will sort of look at it, scan it to see whether the paper, the themes are in line with the journal. And then from there, if they think that the paper or the message is it fits the journal and the publication types that they do, so then it will go to peer review, where it will be reviewed by two independent academics.
Mm.
Um, so it's in most instances the paper is blinded. So those two reviewers have no idea who wrote the paper. It's that way
Mm-hmm.
it's objective, and they're not influenced by seeing, let's say, the name of a professor they might know
Mm.
from or that they might respect, because then there would be some sort of bias.
Bias, I
We don't know.
guess. Yes.
We don't know. Yeah, so that's peer review. So the paper has to be reviewed by two independent academics, and then they will sort of pass their comments back, pass the feedback. They could say that the paper is not acceptable. They could say it needs some revisions, which could be minor or major, or they could say the paper is acceptable for publication. In most instances, it will either be revision or
Mm.
it's rejected.
So you are
So
one of the reviewers.
I'm one of the reviewers. Yeah.
Ah, okay. What skills does one need to have though to be able to peer review journals?
Well, I think someone basically you need research experience, and
Mm.
you need to have gone through the process yourself. That way, you understand it. I mean, it's nothing complicated, but obviously, there are academic requirements. I would say most people have PhDs. So,
what specific skill do you think you've been able to transfer to your role as an epidemiologist?
oh, I'll tell you, effective time management, because that was that was so important. When I was doing my PhD, I was working full time. So I needed to I was doing the PhD full time and working full time. So, that, my previous work as a physio really helped in terms of that, because, as physios, we have specific time slots. When you're waiting for your next patient, you need to make sure, you're watching the clock, but you want to give the best treatment possible to the person that you're currently dealing with. So we have to be sort of, we are on the ball in terms of time management. The other thing would be communication. So engagement, because working in epidemiology or in research, engagement is very much part of how the findings can be made more public. So you need to come up with clever ways of how to publicize your research findings to try to catch the attention of policymakers or governments, because at the end of the day, those are the people that have the powers to make and change decisions. So in research, in health research, most of the time, we're trying to use our findings to influence policymakers or those in charge, so that changes can be made to improve the health of populations.
So if you reflect on your professional experience so far and your career, what would you say is the most important life lesson you've learned so far? It's a big question.
Very interesting. I would say, to be determined, not to give up, just to, because, I mean, it's been a long road, because honestly, when I did my undergraduate studies, I never imagined that I would even want to do a master's, or let alone a PhD. I was just I was just no, that's not for me. But when I did catch the bug, there were barriers that were in the way, there were hindrances and some barriers. So I learned about being over, just being determined and not letting those mini hurdles affect you from reaching your goals.
How long was your PhD, by the way?
4 years.
4 years. And then your master's?
A year.
Okay. All right. And do you have any regrets about your career path, what you've chosen to do in terms of your career path?
No, I don't. I don't think in terms of career, you should hold on to regrets or anything like that. I think if one is feeling like, okay, maybe this is not what I really wanted to do, instead of feeling, regret, they should thinking about it in a constructive way. How do I address the situation? What can I do? Otherwise, when you're just feeling regret, it's kind of like it's negative. You're not really working on a solution to resolve that issue. So so I don't have any regrets.
You don't have any regrets.
If there are bad things that have happened, or negative things, they have helped to shape where I am now. And I'm sure there will be disappointments in the future as well. But in terms of I don't, no regret.
Okay. Would you have done anything differently?
Not Not
No.
really.
Okay. No, that's good to hear. It's good to hear. What would you like your next career? What would you like your next career move to be then? What does the outlook look like for you?
I would love to work for WHO. They have like an injuries unit, and they do a lot of work. They produce like the world report on road safety. So I I very much feel passionate about road safety because you know road traffic crashes are preventable,
Mm,
but that's not the message that's out there in many countries. They're just seen as fate, whereas it's something preventable. So I would like to carry on working in sort of road safety in some sort of capacity, and yeah, working at the injuries unit with the WHO would be a dream come true.
big organization. Mm,
Yeah.
okay. Lastly, what words of
Mm,
advice would you give to someone that wants to change their careers or transition into something non-clinical?
mm. Okay, I would say go for it. I mean, if that's what you want, because you still have your skills as a physio. You can always go back to it.
Mm,
It's not gonna be like, after 2 weeks, you've lost all your skills. Take it from me, I know I'm still an excellent physio, like in a clinical capacity, but it's just I wanted to do other things, and I would really encourage them to go for it and not to be discouraged, worrying, because I do know it was a worry of mine
mm,
but I got some really good advice from the CSB, and so and I know there are a lot more physios who are branching out and doing other things, like,
mm.
so I'd say go for it. But it's not everyone. Some people are really happy to stay in clinical work throughout their careers. Um, yeah, so uh, do what feels right for you, and don't be discouraged.
That's true. I think it's just seeking advice, like you say. And I think if people
Mm,
start to see more physios use their skills in
mm,
different roles, you might
absolutely,
feel more encouraged, because I think that some
absolutely.
physios think that they're only limited to a patient facing
Mm,
role.
mm,
So
exactly.
it's good to hear that you
Yeah,
can
yeah.
sort of diversify. Where can people find you if they wanted to ask you more?
So I'm on LinkedIn. My name is Mitchel Chatukuta on
Hmm.
LinkedIn. So they can add me. I'm very I'm very open to friendly communication and sharing of ideas. So feel free to connect.
Okay. What do you do to relax?
Ah, so I love traveling. Unfortunately, at the moment, I can't
Yes.
do any of
Hmm.
that. But yeah, travel is one of my most favorite things because I just I always like to discover new things. So if I go to I always like to go to a new city, and go off the beaten track, find out how the locals live their lives, just find out more, because I always think you learn something new each time I always find I learn something new every time I travel somewhere. And yeah, I love it. Also listen to music, find it very calming and relaxing. Um, Try to go to the gym. I don't go as much as I should, but I try. Yeah.
We always, I think, as health professionals, because we are in the business of caring for other people, it's always
We are.
important that we find way to take care of ourselves as well. Well,
Yeah, yeah, yeah.
Mitchell, thank you so much for sharing your time. I
Nah,
really appreciate it, and I wish you
nah,
all in future.
thanks for having me. Thanks for having me.
You're
And thank you,
welcome.
and wish you all the best with your podcast. I think it's a really
Thank
good thing,
you.
actually.
Thank you for listening to this episode. If you like the podcast, please subscribe, rate it, and review it on iTunes, as this can help others find it. If you'd like updates on the podcast, you can follow the pages on Instagram or Facebook by searching for Well Restorer. If you have any questions or would like to give some feedback, you can send an email to info@wellrestorer.co.uk. Thanks once again. Take care.